Thank you. Being 4:30, I'm going to call the meeting to order. Councillor Lennox Zepp, you're on the line?
I am.
And I've noted on each case to make sure that I give you an opportunity to speak. So if I do forget you, just yell at me. Okay, I call the meeting to order. I'll ask everyone to rise and the city clerk to say the prayer.
O God, let us each in our own way ask your wisdom and guidance in our deliberations. Help us to incorporate into all our decisions those values which will enable us to fulfill our mission, to act as responsible stewards, and to respect and value the cultural and spiritual traditions of all citizens of the city of Prince Albert. For this we pray. Amen.
Thank you. Before I go to ask for a motion for the approval agenda, Madam Clerk, is there any changes to the agenda?
Mayor Dion, we do have correspondence from the president of QP 882 that they have submitted for consideration in regards to item 5.2. We also have correspondence from Lori Fletcher, an individual who lives outside of the city that has also submitted correspondence on the agenda.
Okay, thank you. So if I could have a motion then to approve the agenda as amended? Councillor Head.
Thank you, Your Worship. I'll move that the agenda for the meeting be approved with the following amendments and that the presentation, delegation, and speaker listed on the agenda be heard when called forward by the chair. And also, number one, adding correspondence from QP 882 to item number 5.2.
Thank you. Seconder? Councillor Miller?
I'll second, Mayor Dion. Thank you.
Thank you. Any comments? I say no one in the queue, so I'll move the question. The question is now open. Councillor Zepp?
Yes.
Thank you. Motion carries. We'll close, accept. Move to the next item. Conflict of interest. You all know the rules. If you have a declaration, you claim it at the time and give it to the city clerk in writing. Number 5, reports of administration. 5.1, land sale construction. So maybe what I'll do is I'll ask the director if he'd like to explain what this is, because it's over and above the original tender that we asked. Go ahead.
Special counsel, I must stand.
Yes, we're at council.
So thank you very much for this opportunity to speak to this item. So in essence, back in April when we approved the budget and the construction tender, the overall general contractor to build the extra cell, at that time, you can see in the attached report from April, it also set aside a $250,000 budget for electrical and pumps. So back in April, even though we needed to tender early so that we could get the earthwork started as soon as weather permitted, so that'll be done before winter freeze up. There were certain aspects of the electrical and pumping system for the leachate collection for all cells, the existing cells and the new cell, that still had some unknowns. And we could have tendered it at the same time, but as you can see in the report, we were estimating it could be as much as $250,000. So it was budgeted at that amount and approved back in April. But subsequently, waiting was the smart thing to do, because in further investigation with the engineers and with our contractor on site, now that he's exposed things, open manholes, connections, existing electrical lines, with the completion of the design and the pumps and electrical system, an agreement from the contractor on the actual price. The price is now only $154,000, so basically a $96,000 savings on that item. So that's a good news story for this evening. The second item on this is the discovery of leachate under the original cell from 2002. So each of these cells, including the new one, has this leachate system that has piping underneath, and it's covered with a polyurethane liner. So the system that's under the very oldest cell from 2002, which was not detected during our geotechnical or our sampling of any of the test wells, but was detected once the contractor started digging along the perimeters of those cells, that there was a broken pipe and a crushed pipe, which was leachating into the area underneath the south side of the first cell. So once the investigation was completed and it was reported to the ministry and the tests have come back, some of them have come back, but we're anticipating that there shouldn't be any further issues, but the pipes and all the infrastructure in that area has to be replaced because it was crushed from, I don't know, maybe poor material or the weight of the cell, we're not really sure. But that is totaling approximately $160,000 worth of repairs, which is a change order. Now, we do have a 5% contingency, which is $313,000. So it's just a little less than half of the existing contingency. So approximately 2.46% change order. So at this point in time, I would ask that council would approve both of these items and the construction will continue. And they're both within the present budget that was approved back in April.
Thank you. Any comments, questions, motions? Wes? Councilor Kilmer?
Yes, thank you. I would like to move that the landfill Cell 1B, Cell 1A, Cell 2A expansion electrical pump and expense be approved at a total cost of $154,350, including PST. That the mayor and city clerk be authorized to execute the agreement and any other necessary documents on behalf of the city once prepared. That the expenditures for remediation of the discovered condition of leachant discharge outside of the landfill cell liner be approved at an estimated total cost of $160,000. And that the landfill Cell 1B, Cell 1A, and Cell 2A expansion project be approved at a total cost of $6,587,395.74, including PST.
Thank you. Councilor Head?
Thank you, Your Worship. Just a question to the director.
Oh, I need a seconder first. Sorry. Councilor Edwards?
I'll second that, Your Worship.
Thank you. Go ahead, Councilor Head, with your question.
Thank you. So just a question to the director. How long has this been leaching for? Since it's a 2002 cell?
Thank you for the question. So it's impossible to determine how long it's been leaking. It did not show up in any of our well water monitoring. We didn't notice any differences or changes. And in the testing too, it hasn't shown any additional residues or residuals compared to any of the monitoring tests. But when excavating around the perimeter to expose all the header pipes, it was discovered that it was crushed and leaking. We did put a camera down one of the lines and jetted it, and it came to a crushed point in the pipe, so that had to be excavated. So, but how long has it been happening? It's unclear. It's an unknown.
And I guess one more question.
Go ahead.
So the cost of the pumps, why the drastic change in the ask for those pumps?
Thank you. So as I had mentioned earlier, early in the design, of course, the pumping capacities and the electrical wiring, this is related to the new cell, but also to the existing cells. And at the time, we wanted to make sure that the tender got out in the very beginning of the season so that the moment snow was gone, we could start the earthwork. But the electrical and the pumping is a little more complex, and the engineers felt we could put it out as it was, but with the risk that not all details are known. So it worked out better that we hired the contractor. He started digging on the site. He helped excavate some of the headers and the electrical lines and testing, and we were able to determine what needed to replace and what didn't need to be replaced, which resulted in a $96,000 below the estimated budget that was back in April. So it was a cost saving to the city of Prince Albert.
Definitely a cost save, yes, good news today. But one of the points I would make show on page 4 of your report, it says, not approving this will result in a violation of the Ministry of Environment. So again, it's not a choice that we have to debate today. So it's something that I guess more of a formality. So thank you.
Thank you. Any other comments? Councillor Zepp, any comments? I'll take that as a no. And I'll prompt the question. Question's now open. Councillor Zepp?
Yes.
Thank you. Motion carries. Okay, I'll move on to 5.2, mandatory proof of COVID vaccination, negative COVID-19 test to employees and the public. And we have one speaker registered to speak. That's the Vice President of, there's two? Okay, and we'll ask, is there two? No, sorry, no, we only have one. Oh, you have two? All right, so you know you have 5 minutes. What happened? Jim kicked it.
Yep.
Okay, I'll turn the microphone off after I get the inductions. So if you could introduce yourself and the guests that you brought with you, we'd appreciate it. I'll just prompt. Podium, right at the top. Grant the floor. Okay, the podium, you're live.
So today I have David Bramick, the treasurer, or secretary. I got Andy Taverneau, treasurer. Mira Lewis is our national QP rep. Leslie Moreau Bartley is our president. I'm Mike Huxley, vice president. And I'll let Leslie go first.
Okay, you're up.
We understand that the employer has an obligation to provide a safe workplace to all of its employees. We also understand the situation. We know what with the medical health officers are advising employers in the province to do. We are neither oblivious nor are we opposed to public safety. We are opposed to it turning decent people who are valuable, long-term employees into villains. Line 101 of the policy says that the City of Prince Albert will employ reasonable precautions to protect health, safety, and welfare of its employees and others from unreasonable exposure to the hazard of COVID-19. However, this policy is very poorly written. Part 1, titled Policy, is lecture and a justification. The purpose of the policy should be to keep employees safe. All of them. The fact is that there is a whole world of information available to everyone and that people have the right to make choices for themselves. I may be wrong, but it seems to me that the purpose is to keep COVID out of the workplace. Neither the vaccine nor the test are perfect. If that really is the goal, then the most reasonable thing to do would be to have the antigen test at work. The unvaccinated have to test regularly and on their own time, and more often when necessary, such as during an outbreak or if there is positive employee in a work unit. The vaccinated can be tested on work time, and it's warranted such as during an outbreak. It also needs to be said that this policy is incomplete. Item 704 says that employees will need to provide to the employer of a form acceptable to the city proof of a negative COVID test. We don't know what that form is. The city has the ability to get a stockpile of antigen tests. If the intent is to keep everyone safe, then get the tests and have the unvaccinated test right at work. It will reduce the amount of paperwork and it won't abuse the healthcare system, which is currently experiencing a staffing crisis so severe emergency rooms and the province are regularly closing. Do the same for the public entering facilities. The antigen tests have been deregulated. There is no need to have healthcare professionals administer those tests. There may be private labs setting up shop, but then we have to have a conversation about the city's responsibility to everyone. If you force people to run to a lab, provide or otherwise, to get tests that need to be done right there at work, then you are using up those services of healthcare workers who are needed elsewhere. You may feel that you are creating a safer workplace, but what about people who are getting turned away from hospitals because there aren't enough healthcare workers? The fact that the lab is private is irrelevant. We only have so many healthcare workers, and if they're administering tests that can be administered by anyone, is that really responsible? They shouldn't be employed to fulfill your policy requirements. You could hire one person to administer the tests around the city. You'd be safer and far more responsible to your employees and your community, because stealing healthcare workers right now is critically irresponsible. You may argue that the unvaccinated are the real problem, but if that's your argument, then you have to agree that your policy is meant to be coercive and punitive and not to make people safe. A policy about safety needs to be written with the reality in mind. The reality is that there are people who cannot vaccinate due to medical or religious reasons, or people are just too scared. They aren't trying to endanger anyone, they're just scared. Turning them into villains does not solve the problem. If you don't cure anyone, it doesn't stop the pandemic. It doesn't stop the massive flow of the information that tells them they should be scared. Sorry, I left you.
Yeah, 30 seconds, that's not too bad. So my argument is the CBA with 160. I broke it down to three things: the preamble, 101, classifications, 2102, and safety measures, 2008. I assume you guys do our contract, and I'm open for questions.
Okay. Is there any questions of our guest? No? Thank you very much for your presentation. Oh,
Tara Lennox up here.
sorry, Tara.
I apologize. Thank you very much for being here, and I do appreciate when people do come to council and reflect their views, so thank you. I had a question. Some of the material that you had sent indicated a concern about the word termination in the document, and that being a jeopardy and a risk for employees, and instead suggested temporary layoff. Would either of you be able to tell me kind of how you find that would be a better choice?
Go ahead, sir.
I believe you're talking about an email from Tammy from 882. That's not us.
Okay,
Okay, thank you. I
Sure.
apologize. That's some material that we have before us at council, but I do appreciate you coming. Thank you.
thank you. Okay, I'll prompt the question. Oh, sorry, we don't have questions, sorry. Discussion and motion, please. Oh, I can shut the volume off. Councillor Edwards.
I'll move the recommendation that in order to best meet the legislated obligations of both the city and the city employees to provide and cooperate towards safe workplaces, it is approved, A, that administration proceed with the implementation of a safety policy for mandatory proof of COVID-19 vaccinations applicable to all city employees in all city of Prince Albert facilities and workplaces. B, that employees that do not provide proof of being fully vaccinated with the recommended number of doses of a federally approved COVID-19 vaccine by October 25th, 2021, they shall submit proof of a negative COVID-19 test taken within 7 days prior to reporting for work. C, that the test is being completed on non-work time and at the employee's cost. D, that if the city receives their first vaccination by October 20, or D, that if an employee receives their first vaccination by October 25th, 2021, the city will reimburse the employee for the required testing until November 22nd, 2021. E, that all third-party contractors who come into regular close proximity to the city, employees and workplaces confirm that they have a policy that meets or exceeds this safety standard. F, that all members of council provide proof of receiving a COVID-19 vaccination to the city clerk by October 25th, 2021. And G, that all volunteers who access city facilities be in compliance with the same regulations for members of the public accessing city facilities effective October 13th, 2021. And 2, that in order to protect all city facilities and workplaces against the spread of COVID-19, it is approved. A, that all city facilities, excluding the police service headquarters and substation, city hall foyer, and the airport, require proof of vaccination for those eligible, or alternately proof of a negative COVID-19 test taken within 72 hours prior to entering the facility, effective October 13th, 2021.
Thank you. Seconder? Councillor Zierakowski?
I'll second that.
Thank you. Okay, comments? Councillor Zierakowski?
What I like about the motion is, in particular, is D, that if employee receives their first vaccination before October 25th, that the city in good faith will reimburse the employee for the required testing up until November 22nd. So that's working with our employees. That's trying to create a safe workplace environment, not with a heavy hammer, but with a soft nudge, working together step in step, so we can create a healthier workforce and a healthier community.
Thank you. Councillor Edwards? Your lights. Oh, sorry. No problem. You were in the queue next. No problem. Councillor Miller?
Thank you, Mayor Dion. So I want to start by saying that I agree with motion put forward. I know 14 days from this past weekend, our healthcare system will be under great strain, like it already is, because of our decisions to gather and have turkey meals with our families, and making sure that everybody was vaccinated was difficult. And I'm sure that we made provisions for some. I guess I have a question for our fire chief. Is our firefighters able and qualified to do testing for COVID-19?
Thank you for the question, Councillor. As of right now, I'm not sure where the health regulations stand with providing testing, the PCR test. But a few months ago at my last update, you were required to have be a member or be a licensed body with the Saskatchewan College of Paramedics. So I don't know if that answers your question, but there is some talk of deregulation for the testing, but I can't speak to that.
Okay, thank you. And I'm glad to see that the city is willing to pay for the testing for the employees after the first shot. Thank you.
Welcome. Nope. No. Councillor Brodnick. Sorry, he's in the queue first.
Thank you,
Then
Mr. Mayor.
And then Councillor Zepp, if you'd like to comment after Councillor Head.
Thank you, Mr. Mayor. I too am in favor of the motion, and what I'm in favor of is the fact that we've got a crisis here in our province, and we're trying to deal with it. And we're not forcing, nobody's being forced to get vaccinated. You have an option of a negative COVID test. That's the option. and I think as a collective, as a society, we need to tackle this issue of this pandemic very seriously. And that's what this attempt is to do, is tackle it, but also make it safe for all of our facilities, people working in all of our facilities, people visiting all of our facilities. And that's what it's about. When the province, people might say that it's my body, I can do what I want. You're right. However, what's happening is these decisions are having an impact on all of us. 200 surgeries are being canceled every day in Saskatchewan right now.
Shame.
I have a family member that needs bypass surgery. His surgery got canceled because he didn't have that short period of time after surgery for an ICU bed in Saskatoon. The cardiac unit, there's beds there where he'd be transferred after his surgery, but they don't have that short period of time for the ICU. And his cardiac surgeon said he had 9 surgeries, open heart surgeries planned for the week that my family member was supposed to have that surgery, and only 1 was able to happen because of beds being taken up by unvaccinated, majority of unvaccinated COVID patients.
Shame.
This is what it's about. I have a child in my ward who has cancer. Same thing is happening, is the beds are not there. If she should happen to fall ill, which I pray she doesn't, but if she happened to fall ill, the bed is not available for her. And this is the problem that we're in. We're in a situation where this disease, this virus, is spreading so fast. It's killing more people in Saskatchewan per capita than anywhere in Canada. We have the lowest number of people that are vaccinated, even though it's at 79-point-some% that are vaccinated, which is good. We need to get it higher. And that's why I favor this. This is a public health issue. It's not a political. It's not strictly economic. Yes, it's going to cost money. The civic facilities might lose money. Groups might lose money because of people pulling their children out of registration, etc. But this is a public health issue. This is a serious public health issue, and that's why I think we have to act. Right now in our province, when we're having 500 positive cases a day, 20% of those are children. 20% are children that are testing positive, and they're not able to get vaccinated. And the stats say of those children that are testing positive, 98% are from families where their parents aren't vaccinated. Religious reasons. I know of two organizations, the evangelical organization, and I'm not exactly certain their name, but it's churches that are tied to the Pentecostal Assembly. They said there's no religious exemption in that entire organization across Canada. There's nothing in Scripture that says that you should not be vaccinated for religious reasons. So there is no religious exemption. The Catholic Church also has come out. There is no religious exemption for Catholics based on Scripture or based on the doctrine of the Church to have a religious exemption. It's a personal belief. It's not a religious belief. So for these reasons, I think I'm voting in favor of this motion, as I said, because it's a public health issue, mainly a public health issue. Has nothing to do with politics, very little to do with economics. Economics is tied into it, but it's a public health issue. So that's why I'm going to support this issue. Thank you, Mr. Mayor.
Councillor Lennox Hepp, do you want to comment before I close?
Yes, please. I have some
No.
questions for administration and then some comments as well.
Go ahead.
The first, this may be for finance department. The report indicates that there are costs involved in having someone be available to do the checking of this. And so I'm wondering, I've been asked a question, where do we propose those funds come out of? It's approximately $200,000 that's estimated here.
Go ahead, turn your light on. Go ahead, Director of Finance.
Thank you for the question. Since it's been it would be an unplanned budget expenditure, it would have to come out of fiscal stabilization.
Thank you.
Thank you. I had a question. In the report, it indicates the landfill kiosk being affected, and question for administration, what exactly would that mean for the public?
Go ahead, Director.
Thank you for that question. So as far as we're concerned at the present moment, as long as the public never enter the kiosk, there would be no implications because you stay in your vehicle, you're just at the window, you can go into the landfill, unload your vehicle, and return to the other window and leave the facility. But the kiosk would otherwise be out of bounds. It already is out of bounds for the public, but if there was reason for someone to have to go inside, then they would have to be proven vaccinated before they could enter.
That makes sense. This question may be for corporate services or the city solicitor. It's about the language for employees, the termination language. I'm just wondering if there's a reason that the city would use the jeopardy being termination for employees that were not in compliance, as opposed to the language of temporary layoff. And I'm wondering if there's a reason for that.
Go ahead, Director.
Thank you for the question. The language is actually up to and including termination, and that's pretty standard language to indicate, and there's a reference to the progressive discipline policy. So it's not a move right to termination. It's if there's active non-compliance with the policy on multiple occasions, then it moves to termination.
And administration would think that that is the best option as opposed to the phrasing temporary layoff?
In terms of temporary layoff, so the option that would be open to employees is to arrange in advance that's their preference, an unpaid leave without pay, and the term of that leave. But that would have to be made in advance, not on the day that testing requirements are enacted.
Thank you. Question for administration. This might be for community services. Community clubs, several of our community clubs are run by volunteers, and some of them, I'm thinking of not the ones with ice rinks, but places, for example, Hazeldale Hall and the smaller clubs. I'm wondering, from administration's perspective, who are you expecting to be performing the checks at those smaller halls? My concern, of course, being that I don't know that our volunteers are able to be there and able to act in that way to perform checks. And I'm wondering what the intention is for those smaller halls.
Go ahead, Director.
Thank you, Mayor Dion. To Councillor Lennox Epps' inquiry, so it would be a combination of factors. It depends on the use. So in some of the cases where a community hall is rented for a private event, there is a requirement and responsibility on the renter to adhere to the policy. In situations where we have public access, under our agreement, we will be working together with them to establish times where they need assistance to check for proof. So there are examples where, for example, our 4 indoor natural ice arenas are under operation later this winter. They will require weeknight and weekend assistance, and that's built into the projected costs that are identified in the report.
Thank you. So just so I understand, if it's private rental, then the intention is that the renters have bear that responsibility.
Mm-hmm. Yes.
And then a question for communications. I think this might be my last question. I note that the city of Saskatoon are also imposing measures that are similar to these proposed measures for the public. And I noticed that the city of Saskatoon has a phrasing here I just wanted to ask communications about. So the issue is that there will be some 11-year-olds today that are today not eligible to receive a vaccination, And then, you know, in some months from now, they will turn 12 and they will be eligible. Those 11-year-olds may be on a sports team right now, and they then turn 12 and are eligible. They would have a time period where they would have to get their first dose and then their second dose, and then 14 days past their second dose. And so what the city of Saskatoon did about that, it's just one sentence here I'll read. And my question for communications is that something that communications has already maybe flagged or will flag for the outlining of our city policy if this passes, to deal with that. So here's the sentence from the City of Saskatoon website. All children turning 12 after July 15th of 2021 will have 3 months from their birth date in order to be fully vaccinated. They will be allowed access to city leisure centers and indoor rinks during the 3-month period. And if anyone's curious about that July 15th date, I think that corresponds with the October 15th date is the date that the City of Saskatoon is enforcing these measures. So that's July to October is 3 months, to give them 3 months time. So I don't know if that was clear for the Director of Communications, but I'm just wondering if that's something that we're looking or could look into.
You're up, Director.
Thank you. So my understanding is that all children born in 2009 are actually eligible for the vaccine. So if you've just turned 12, you have the year to, you would have had the whole year to have gone for the vaccine. That said, there is some language there that might be helpful if council was interested in that. So the intention for communication was to make it 12 and up. That is how we were going to approach it.
Yes, okay, I appreciate that. And I guess my thought is just as time, that's absolutely correct. Everyone who's born in 2009 currently can receive that vaccine, but as time goes on, that, you know, that will change, and we may be wanting a paragraph like similar or like that as time moves on. Also, kind of in conjunction to that, I would just note that, it may be something that the city might want to look at if and when vaccine ages change. So that's just something to think about as well. That's a different topic, I guess. On to my comments now. My first comment is I again want to thank CUPE for coming and speaking with us. I always appreciate when people come to council and bring their thoughts to us. I really do respect the interest and need to have safety for the employees and to be thinking about these things for our employees. I see this proposed policy as looking to the city looking to wanting to keep our employees safe in a very difficult time, and you know, it is certainly I understand the concerns that were raised, and I really do want to see that safety measure here. I wanted to note that this issue came to us at council as a result of Dr. Chikani from, he's the Prince Albert Medical Health Officer, coming to council on September 7th of 2021. That's what started this issue here at the council chambers. Dr. Chikani came to council, provided an extensive PowerPoint presentation about the risks and what is happening in our hospital and community. And he encouraged us as a city council to look at measures that were more than what the provincial government was then and now implementing. And because he came to us and he asked us to help for two reasons. One, two goals that he had. One goal was to save lives from preventable death. And that is, as a city councillor, it is very persuasive to hear your medical officer for your city ask you, will you help us save lives? That's pretty impactful. And I think that if many people in our city were in our shoes, in my shoes, that they may think that we may need to make these quite serious, and we take them seriously. I take these measures, proposed measures, very seriously, that there's a serious reason why we're even considering them today. Dr. Chicani's second goal was he asked us to consider more measures than the province was implementing as a goal to try to keep our healthcare system from collapse. And we do, that is also serious that we need to take, and we are taking seriously. I wanted to state that I do find it very concerning that a municipality is even in this situation, that this is something that a provincial government has the ability to create and consider further measures, especially when their own health officer for Prince Albert is asking for them, and the province failed in that. The province has not implemented these measures that we're talking about, and they have left us, City Council, in a very difficult position of trying to do the right thing, to follow what Dr. Chicani is asking of us to save lives, when it's really the provincial government who has the real life data. They have the most information on this issue, and we have to listen and consider our medical health officer. Lastly, I received an email from a nurse at the Victoria Hospital ICU intensive care unit, and it's short, and I would like to share it with the public, and she has told me I could share it with the public. And this is someone who is on the ground, who is actively working as a nurse, trained in ICU and working in the ICU, and knows what is happening in our city. She says, "Hi, Tara. I support the option to place proof of vaccination or negative COVID tests for entry into all city-owned facilities and employees volunteers. As a nurse working in the Victoria Hospital's over-capacity ICU, I support all measures that help put the responsibility on people to help stop the spread of COVID. The health system needs help from the community. This still provides people with choices, the choice to enter facilities, the choice to vaccinate or have a COVID test. Children under the age of 12 do not have choices, adults do." And so that is persuasive. My last comment is just to say that this is not an easy measure to consider. It will impact many people, and I respect that I've received correspondence from both sides of the issue. I've received lots of emails from people, members of our city, stating that they want to see the measures, and I've also received correspondence from people in our city saying that they do not want to see these measures. It all comes down to for me, it comes down to Dr. Chicani and what he's asking us to meet these goals for our city. And it's not easy, and it's not perfect, but it's very important. Thank you.
Thank you for those comments. Councillor Edwards.
Thank you, Your Worship. Just a few words as the mover of the motion. I thought I should talk. Councillor Lennox Zepp summed it up very well. This wasn't an easy decision. This wasn't something that City Council said we got to bring this forward and enforce because we want to do this against employees. That's far from it. Our healthcare professionals came to us pleading that we put something in place. Why? Because our hospitals are filling. People are getting sick. Not because, hey, City Council, do this because you got power. It's not what this is about. This isn't about us against employees at all. This isn't an easy decision at all. Our Dr. Chicani came here, showed us the statistics, showed us the numbers, talked to us and said it's getting out of hand. This was a month ago, and those numbers have gone up. So why do we need to put these policies in? Because our healthcare professionals are recommending we do. I heard some statements today critically This policy is critically irresponsible. I don't agree. I don't agree with that. We've allowed choices to go get tested. Federal government employees don't have that option to get tested. It's, you'll be vaccinated or you're off without pay, period. We went a step further. I've heard, we've all heard, statistics are skewed. You know, Dr. Chokani came here, the statistics are skewed. For what reason would our healthcare professionals want to skew numbers? What benefit does the government have to skew those numbers? Shut down society for what? To make people lose their jobs? I don't think so. It's because there's a virus out there and it's killing people and it's making people sick. So this is why I support this policy. Is our numbers are increasing, especially in northern Saskatchewan. So we need to put this policy in place. And again, it's not against individuals. I hesitated myself to get vaccinated, hearing all the information about how it enlarges hearts. You know, the vaccination can enlarge hearts. So I hesitated. I hesitated for myself. I hesitated for my children to get vaccinated. And then I think about what viruses can do and what we're seeing, what they can actually do. Viruses, a virus, not COVID, but a virus killed my dad. Attacked his heart. So are we perfect in implementing all of these things? No. But you know what? It's what we think is the best choice. Encourage vaccinations because it helps curb the spread. That's why I support this motion. If we can't trust our healthcare experts in Canada who are encouraging us to do this, who can we trust in this world? I don't know.
Okay, I have a few comments, of course. I too will be supporting this motion. Because weekly, I'm one of the fortunate ones in the province that get briefed weekly on what's going on in our province. And both the experts in health blame, of course, the new aggressive COVID virus, totally different than the other three, and our low vaccination rate. This came out on the CBC today, and I think it just saddens me that our province is in this way. In Saskatchewan, 40 people a week are dying from COVID. Per capita, this is even higher than Alberta. The death rate in Saskatchewan is 21 times higher than Nova Scotia. You know why I got vaccinated? I got vaccinated because of my neighbors. I don't have to get vaccinated, I'm the only one in my household. But I got vaccinated because of my neighbors. I have respect for my neighbors and my friends. That when they invite me into their house or their home, I won't bring anything with me. And I try very hard to do that. I've really cut my circle down. My public events I've cut down, strictly because COVID is still running rapid. And I believe it's responsibility of us all to do our part. But I too have to echo what Councillor Lennox Epp said. We should not be having this meeting today. The province of Saskatchewan should be announcing this province-wide. This is not a Prince Albert problem, it's a province. It's all over our province. And I am shocked. Before July 11th, we were the second best province in the country when it came to COVID. We took the summer off. We're now the second worst province in the country. That's not something to be proud of. And I've heard all the antis. Somebody told me, and I responded in a positive way, because I'm a positive person, asked me if I got double vaccinated. I said yes. They told me I had a chip put in my arm. So now people know where I can be. And I said, well, that's good, because I go out picking berries in the bush and sometimes I get lost. Now I can phone somebody and ask them where I am. That's how ridiculous that sentence was. I have a chip in my arm. I've had people that says your arm's now magnetic. And the thing of it is, they all know somebody. You talk to them, they all know somebody that's been affected by COVID-19. So they can't say it's not here. And I'm not infringing on anyone's rights. People say you're infringing on my rights. No, I'm not. You're infringing on my rights to be safe. I am a very proud Canadian, and I'm a very proud Saskatchewanite, and I'm a very proud person from Prince Albert. One thing I've learned in government, we live in a democratic society, and the majority rules. Not the minority, the majority. And the majority of us has got vaccinated to help our friends and our neighbors. The minority is the one that are spreading the false stuff. I'd like to meet Dr. Facebook, Dr. Twitter, all these social media ones. I'm very blessed that I'm not on social media. And I tell people that. Why are you even on Facebook? I've never been on Facebook, but all I've ever heard from my friends and people on Facebook has never been anything nice. It's gossip, it's lies, it's misleading. And people think because it's on Facebook, it's gospel. And it's not true. It is not. So I am disappointed that today we're in this position, but we were put in this position by our government, not ourselves. And I do respect everyone in that hospital. I do. And when I hear these sad stories of all this elective surgery that's being canceled, and those people, think about it, those people that have been waiting for the surgery has done nothing wrong. Nothing. And those beds are taken up by people that could correct it. And I think that's wrong. People should not have to suffer because a small minority of our population doesn't want to get vaccinated. That's fine. I have no issue with that. But every time I get an opportunity that the government's given me to help correct that, I'm going to do it because I respect my neighbors and my friends. Okay, I'll prompt the question. Councillor Lennox Epp?
Yes.
Motion carries 8-1.
Mr. Mayor, I have a second motion on this same topic.
Okay, just give me 1 second here. Okay, go ahead.
That the city send a letter to the provincial government stating concerns with the provincial government's COVID measures, which have left the city in a position of implementing its own COVID measures.
Can I just add the word before letter, the word strong? The city
Yes.
send a strong letter. Okay, seconder? And I would take it that would come from my office, Councillor Zepp?
Yes, when we've sent letters
Okay.
in the past to the provincial government, I have understood it's been through the mayor's office
Yep.
and considered to be sent from city council.
Yes, and I'll send you a copy. That's why I asked for the word strong. Councillor Kilmore?
I second that.
Thank you. Any comments or discussion?
I would just make a short comment.
Yeah, go ahead. Go ahead, Councillor Zepp.
Just that when I hear from members of our community and parents in our community wishing that we did not need to implement these measures, of the city measures, I continually go back to September 7th, Dr. Chukani, and that we were asked to implement measures that were above and beyond what the province was doing then, and still above and beyond what the province is doing now. And I'm very concerned that the provincial government needs to hear from us. They need to hear from us why we were in this position. They need to hear from City Council that this was not an appropriate position for us to be placed into, and especially because it's the provincial government, who has the real-time data and has the information on health that to best be able to deal with this. And it should not have taken Dr. Chicani having to come and meet with City Council and imploring us to make changes. Thank you.
Thank you. Okay, I'll prompt the question. No? Oh, sorry, she'll prompt the question. Okay. Counselor Zepp?
Yes.
Thank you. Thank you. It passes unanimously. And that letter will be going out tomorrow. And I'll copy all of council. Okay, with that, I require one more motion. Counselor Kilmar.
I move to adjourn.
Thank you. Seconder, Counselor Miller.
Yes.
Thank you. I'm prompting the question. I want to thank everyone for attending today and be safe. Okay, the question's now open. Counselor Zepp?
Yes.
Thank you. Carried. We're adjourned. See you in a couple of weeks. Be safe, everybody.
Thank you very much.